Joining us now from Los Angeles is Dr. Malkin. He's a concierge physician, pardon me, who has treated many patients with HIV. Doctor, thank you so much for joining us. How important is this announcement to you, to your patients, to the medical community?
Yeah, thank you for having me. This is very exciting for those patients with HIV and just the general medical community at large. You know, HIV, unfortunately, was a death sentence a couple of decades back, but, you know, we've come a long way. Retroviral therapy has been able to keep HIV at bay and not let it progress to AIDS. But now this is, now the second time we're actually seeing a possibility that people can actually cure people with HIV, which is very exciting for patients and the medical community at large.
You know, in our research of you, we found out that many of your patients are HIV positive. Give us your sense, since you know them and you're obviously close to them as their doctor. How important would this be for them? Not just from a medical standpoint, Doc, but from a personal standpoint.
Sure. You know, I do a lot of work in the addiction space, specifically with patients with opioid addiction, a lot of whom have contracted HIV through needle use. And, unfortunately, in that patient population, it doesn't take much to send someone spiraling downward. So a patient who has HIV, who may think they don't have any hope, may turn to drugs or other substances to help cope. This now gives them a sense that there is hope, there is a light at the end of the tunnel, that maybe from a medical standpoint, things can be improved and may give them just enough hope to help them beat their addiction. And I think patients in general, they need that sense of encouragement that the medical community is working on a cure for them, that there is hope. And we've come such a long way just in the last couple of decades that this is yet another breakthrough and very exciting for everyone involved.
Doctor, I have to ask you though, and on the negative side, some of the reports, I'm sure you've read them as well, that we've been reading here at RT America, seem to indicate that there's still a possibility that this particular method that's being used is not something that'll be effective on all patients. How big a concern is that, do you believe?
Well, there's a couple of different ways of looking at this. First of all, people have said that, because this is a bone marrow transplant, a stem cell transplant, it's not really applicable to the large population because of the cost and the difficulty of finding donors to match people's bone marrow transplant. So that's one specific hesitation that people have. But larger than that, the promise really is, in gene editing, to use this type of breakthrough to potentially create genetically modified immune cells that are resistant to the HIV virus. So while this may not be applicable to everyone right now, I think the future is very bright in terms of our ability to adapt what we've learned here to apply it to a larger population.
Have you been in contact with any of your patients yet, or do you plan to perhaps give them a call to share with them the good news?
Sure. You have to be cautious whenever you discuss new findings with patients, because in the medical community, we do make sure that things are vetted and done properly before rolling it out to the general public. Retroviral therapy right now, as it stands, is actually very effective at managing HIV. So that's currently the mainstay of treatment. And while I do want my patients to be excited about the future, I want them to continue doing what they're doing and wait till the medical community fully adopts this as an ongoing treatment.
Yeah, no, I understand. And then there's the whole HIPAA thing, right? So that you have to contend with as well.
Sure.
Hey, doctor, thank you very much. We certainly appreciate you coming on and sharing in this very exciting news with our viewers. Thanks again.
My pleasure.